Do you have the constant, unpleasant feelings of needing to move your lower extremities or sometimes your upper extremities? You may be one of the millions of people that is suffering from a condition called restless leg syndrome. Hey everyone, my name is Autumn. I am a practicing pulmonology and sleep PA, currently working in outpatient medicine, and today I'm going to be diving into the topic of what is restless leg syndrome, aka Willis-Ekbom disease. So, I want to go over the topic of what is restless leg syndrome, what are the symptoms of restless leg syndrome, some common reversible causes that often get overlooked, and then also how we can treat this condition. So, let's get started. First off, let's talk symptoms. What is restless leg syndrome and how does it present? So, restless leg syndrome is an unpleasant or uncomfortable urge to move your lower extremities constantly while at periods of rest. It can also affect the upper extremities, but this is less common, hence the name restless leg syndrome. Symptoms only emerge during periods of rest and will naturally occur more likely in the evenings when people tend to be more sedentary, less distracted, or getting ready for bed. They can also affect patients as they're trying to fall asleep, which will affect their sleep quality. The sensation is often very difficult for my patients to characterize, and so some of the adjectives that I've heard that they use to characterize this restless leg syndrome are itching, burning, tingling, a deep ache or a deep cramp in the legs, the constant feeling like they need to kick, twitch, or move. Sometimes they'll describe it as a pulling sensation or an electric sensation in those lower legs, but it always occurs during periods of inactivity or rest. Usually, they describe the symptoms as more deep in the legs than on the surface, so it's not something that you can just scratch and the sensation goes away. Other clinical features that are typical for restless leg syndrome, or RLS for short, include the tendency to worsen with age. They improve with certain dopaminergic agents. Patients tend to have a positive family history, and they tend to experience a waxing and waning of symptoms throughout their life or during when symptoms are present. RLS occurs in about 5 to 15% of the population, is more predominant in females, and tends to worsen or be triggered during pregnancy, usually around the 3rd trimester. Risk of RLS increases with age and is often found in patients with comorbid conditions like diabetes, Parkinson's, peripheral vascular disease, neuropathy, or spinal cord injury. The diagnosis of RLS is a clinical one. There is no exact test for restless leg syndrome. It can be summarized and clinically diagnosed with the acronym URGE, U-R-G-E, which stands for urge to move, rest induced, gets better with activity, and evening and night accentuation. The cause of restless leg syndrome is not completely understood. We do know that it can run in families. It's linked with a bunch of other comorbid disorders that I talked about early, and there are some reversible causes that we're going to talk about today. The most common conditions associated with restless leg syndrome are iron deficiency, chronic kidney disease, diabetes, coronary artery disease, spinal cord injuries, and Parkinson's. Although, like I said, there aren't any diagnostic tests for restless leg syndrome, you do want to rule out reversible causes before you treat this condition with medications. The first one we have to start with is check for iron deficiency. This is an extremely common cause of RLS, and it's usually easy to fix. All you have to do is get a blood test that checks an iron panel to see if patients are iron deficient, and then you want to see why. So, do they have chronic anemia from blood loss from chronic hemorrhoids, Crohn's disease, gastric ulcers, or other causes of chronic anemia leading to iron deficiency anemia? Are they not getting enough iron in their diet? Can we fix that with improving their nutrition? Iron deficiency restless leg syndrome is treatable and reversible, so we want to test for this. The second reversible cause that I see quite a bit is medication side effects or interactions. Several medications that patients take on a regular basis are known to increase the risk of restless leg syndrome. These include antihistamines, probably the most common one I see that patients take on their own. that don't realize it's worsening this condition. The big one here is Benadryl or diphenhydramine. This is found in a lot of sleep aids that you can buy over the counter. So think Tylenol PM, any of those sleep aids that have Benadryl on them. This can worsen restless leg syndrome. You can also see this in antihistamines like hydroxyzine that's used for sleep and anxiety, Zyrtec or Allegra that patients will take at night for their allergies. These can sometimes worsen restless leg syndrome. So it's important you know that if you started taking one of these medications and didn't realize that it might be worsening that RLS. The second one that we see can irritate or worsen restless leg syndrome are dopamine antagonists. These are medications like antipsychotics and then certain anti-nausea pills, which can, again, if you don't know what's doing this, worsen your restless leg syndrome. Finally, certain antidepressants have also been known to worsen restless leg syndrome. Mirtazapine, which is commonly used as a sleep aid and antidepressants, can worsen RLS. Tricyclic antidepressants like amitriptyline, nortriptyline, which are also used for sometimes sleep aids, depression, chronic pain, they can worsen RLS. And then certain SSRIs and SNRIs, which are prescribed to millions of people every year, can also worsen RLS. So it's important to know that those three classes, the antihistamines, the dopamine antagonists, and certain types of antidepressants can also trigger or worsen RLS. So it's important you talk to your provider about those medications and the effects they might be having on your restless leg syndrome. So those are the two biggest causes of reversible RLS. The other causes that we see that obviously aren't reversible include things like family history. So we know that there might be a genetic link, as it does tend to run in families. Certain peripheral vascular disease disorders. So if you have, poor blood flow to those lower extremities, we can obviously try and correct some of that, but a lot of times peripheral vascular disease is permanent, and so it can worsen RLS. Untreated diabetes that leads to peripheral neuropathy, which is that sensation of burning, tingling, or sometimes a lack of sensation in diabetics, that can worsen RLS. Parkinson's has been linked to restless leg syndrome. Spinal cord injuries have been linked to restless leg syndrome. So those are more of the non-reversible causes or triggers for RLS that we see in clinic. Another one that I see a lot of is chronic kidney disease or end-stage renal failure and uremia can be linked to restless leg syndrome. So dialysis doesn't always help that. Sometimes a kidney transplant will help with the uremia and the restless leg syndrome. But if you have really bad kidney disease and then you have the buildup of toxins in your blood because your kidneys are not filtering, we've seen that that also is linked to restless leg syndrome. Now let's talk treatment. What can you do to help treat this condition? So as we talked about, first things first, treat the reversible causes. If you're iron deficient, you need to increase your iron in your diet, and you should talk to a provider or a nutritionist about this first, because you want to make sure you're not getting iron overload, because that can also cause bad health outcomes. And if you can't increase your iron intake in your diet, then sometimes your doctor will recommend supplemental iron. Then we move on to medications. So look through your medications. If you've started anything new and then your restless leg syndrome got worse, talk to your provider, PANP doctor about that. See if maybe you can come off those medications, but don't ever just stop an antidepressant before talking with your provider. Finally, if it's not the medications, you're not iron deficient, and it's some other cause that we can't really reverse, some of the common treatments that I recommend in my practice include improving your sleep hygiene. So this may include getting a sleep study and making sure you don't have any untreated sleep apnea. So getting a sleep study, improving your sleep, limiting caffeine and alcohol, because we know that these can worsen restless leg syndrome symptoms. Improving your diet, so making sure you're hydrated, you're eating lower carb, lower sugar foods, as if you're a diabetic, high carbs, high sugars can increase your blood sugars, worsen all of the other underlying conditions. Regular exercise. This doesn't mean, lifting really heavy weights and really burning yourself out, but 30 minutes of walking, biking, stretching, yoga, those types of things have been shown to improve restless leg syndrome by up to 50% in some patients. Another thing that I will sometimes tell my patients are cold packs, warm baths, or massage therapy to the area where you get that urge to move sensation or the tingling, stinging, itching, whatever your sensation is with this condition. Then finally, if you've done the holistic approach, if you're sleeping better, eating better, exercising regularly, doing all of the things, making sure it's not medications, making sure you're not iron deficient, making sure you don't have untreated sleep apnea, making sure that your other disease states are well controlled. If none of that has worked, then you should talk to your provider about medications. And these will include medications like gabapentin, pregabalin, which fall into the gabapentinoid family, or medications like pramipexole or ropinirole, which fall into the dopamine agonist family. And you need to talk to your provider about those medications, side effects, and if they're right for you. I do let patients know that if they've been on ropinirole or pramipexole for a long period of time and their restless leg syndrome is worsening, sometimes you should talk to your doctor about maybe coming off those medications, as I have seen patients who have been on these medications for over a decade have a sudden worsening of their symptoms. We pulled them off or tapered them down in clinic with these medications, and their symptoms got better. So that's always a consideration as well, is to trial off or reducing some of these medications if you're already on them and have been on them for a long time. As always, this is supposed to be helpful. I hope this helped you better understand restless leg syndrome, what it is, the symptoms that come with it, some common reversible causes, and how you can treat this. Ultimately, if you have a medical condition, you should always talk to your own provider first to get a better understanding of your health history. Thank you so much for joining me. If you found this content helpful, please give it a thumbs up. Subscribe if you want to see more content like this. Again, I hope you have a great rest of your day. Thank you so much. Bye.